Now, I hope you are excited as I am to hear the pitches from the 6 companies. I would like to share that all the solutions are contributing to the SDG by either reducing poverty through financial products or promoting good health and well-being. So first up, the first company is Chap Chap Africa from Uganda. Please join me to welcome Mr. Christian Wamambe.
Hello everyone, Dan, Head of Operations at ChapChap, Uganda. MSMEs across Africa today struggle to access markets, supply chains, and credit to grow their business. In fact, today nearly 5 in every 10 businesses collapse before their first anniversary. The communities these businesses serve also struggle to access financial services, and the cycle of failure and collapse of the businesses only increases the incidence of unemployment, poverty, and creates further exclusion. In Africa alone, there are more than 120 million businesses that are at the risk of collapse under these conditions. And the unmet demand for MSME credit is already in excess of 360 billion US dollars because only 5% of our MSMEs are able to access formal credit. This is alarming because more than 370 million people depend on these MSMEs for services and their livelihoods. Our solution, ChapChap, is connecting MSMEs through a digital network, making them visible to suppliers of consumer goods and financial services to minimize the incidence of exclusion. For our unbanked low-income earners, the MSMEs are able to facilitate digital and financial transactions on their behalf. Reducing the risk of exclusion by bringing these services closer to them. We provide a mobile app for these MSMEs to enable them track their inventory, maintain a digital record of their sales, and accept digital payments. The MSMEs can then use this business data to unlock affordable unsecured credit from our partner financial institutions, while also earning additional income by facilitating financial transactions on behalf of the people in their community. Our target clients are retailers, wholesalers, supermarkets, and even kiosk operators. And we have impacted the lives of more than 10,000 of these businesses since 2018, and nearly half of them are women. This community has provided services to millions of low-income earners and helped them facilitate transactions to a tune of over 20 million US dollars. ChapChap provides a smartphone application, and in return, we earn sign-up fees and commissions from service providers whenever our network of MSMEs facilitates a transaction on behalf of a low-income earner. And we are already a cash positive business. In fact, we are generating more than 220,000 US dollars per year, and we plan on growing this to $8 million per year by 2025. We have reduced the acquisition cost of an MSME by 40% from $30 to about $20, and our plan is to reduce it to less than $1 per MSME. And we plan to recruit more than 1 million MSMEs in the next 5 years. But we haven't done this alone. ChapChap leverages key partnerships with financial institutions, telecoms, government, and development partners to help improve our product and provide the right solutions for our target market. We are seeking for strategic partners with the capable of providing technical and financial skills towards our business to help us expand in Uganda and also to regional markets like Kenya and Nigeria. We are also looking to raise a Series A fund of $2 million to invest in human resources, technology, and also marketing. Because today, due to COVID, we have to meet our customers remotely, and we want to build our capacity to do that. I ask you to join us in our calls. Thank you for listening.
Great. Thank you. Thank you, Christian.
Thank you, April.
Yes, great. So now we move on to the second pitch. And the second company is MyCash Online from Singapore. So please join me to welcome Mr. Mehndi Hassan.
Hello, hi, good evening. My name is Mehdi. Just a minute, let me share my somehow. Yep. Yep. Can you see my screen? Hello?
Yes, we're able to see it.
Yeah, but I cannot see my screen. Okay, never mind. Okay. So yeah. Hi, good evening. My name is Mehdi. I am the founder of MyCash. MyCash is a financial inclusion startup. We work for the migrant workers. So why migrant workers? Estimated in 2019, there is 200 million migrant workers globally working, and they have sent over $750 billion to their homes. And largely this money is cash. They get cash salaries and send cash to their homes. So we want to change that. Over the years, we have seen that 66% of these migrant workers now using non-banking channels like Western Union to send money home. And the good thing is they own a smartphone, and the smartphone is their a way to use the internet. So we try to use that data and solve the problem by providing them a super app that is tailored for the migrant workers, and it is available in their mother language. This app has everything they need, from mobile top up, remittance, air ticket, bus ticket, to insurance, and soon micro lending, everything in one app. So how it works? So we have a simple process of, so the migrant workers need to use a smartphone. They can download our app. Then they need to do a KYC process. We have an approved KYC process that do a biometric validation of their IDs and their face recognition. After that, we allow them to use our account. As we do not accept any cash, they need to either deposit money to our bank account or transfer to our bank. We have many ways to do that using cash deposit machine, over-the-counter transactions, pay now, bank, and so on. We also accept cards in some countries. After that, they can create an order in our app, and then it will be delivered to their families. We have connected to the banks and remittance partners, wallets, and so on. So how we make money? We are a for-the-profit organization. So we actually charge a small fees to the migrant workers. It's up to $2, and then we have we also get discount by providing buying wholesale mobile top-ups and ticket, all these things. It's up to 5%, and also we do cross-border transaction, so we get a FX gain of around 1%. So we work in 3 countries: Malaysia, Singapore, Australia at this moment. Although we do not provide any remittance service in Malaysia, but very soon we will start to do that. We also registered a company in Qatar, and hopefully soon we will start to serving the Middle Eastern community through Qatar. Our stronghold is Bangladeshi migrant workers. Predominantly, we have around 70% of them. 30% is from other countries like Nepal, India, Indonesia. We started in 2016, and until now we have around this year we did around 35 million US dollar in sales, and we performed 1.4 million transactions in our platform. So our unique selling points is that we are a fully digital organization that work for the unbanked. We do not provide over the counters; it's through the apps, and it is fully digital. So these are some of the licenses we have. We have full license in Singapore and Australia. We are currently in a sandbox in Qatar. We are also partner with international monetary service, transfer service like Western Union transfers. We also directly API connected with banks in Bangladesh, Indonesia, Nepal, and few countries like Philippines and India coming soon. So we are currently looking for $1.2 million of funding. This is mainly will be spending in 3 countries, in Singapore, in Malaysia, and Qatar to run our business and reach profitability by 2020. And our goal to have at least 500,000 customers. We currently have 150,000 customers in our platform. Thank you. Thank you very much.
Great. Thank you, Mahindi. Thank you for that presentation. Great. So, yes, we would like to move on now to the third company, which is Reach 52 from Singapore. So please join me to welcome Ms. Edwina Ong.
Thanks, April. Let me know when you can see my screen. Should I turn on my camera as well? I'm gonna share my screen. Hi, everyone. Thanks so much for joining us. Give me a second. Can you see it?
It's loading.
Okay.
Yes, perfect. We can see it now.
Okay, cool. I'll just start whenever.
Yes, you can start.
Okay, great. Thanks, April. I'll just start my time on my end. Hi, everyone. Thank you so much for taking the time to hear me pitch today. My name is Edwina, and I will be talking about our Reach 52 solution. And what we're looking to do is to build a financially resilient health system for anywhere on Earth. So let's get started. So if we go back to the problem, what exactly are we trying to solve? Right now, 52% of the world, they don't have access to primary healthcare services. That's around 3.7 billion people. On top of that, 1.7 billion people remain unbanked and cash-based. And the reason why we want to strengthen health systems and build financial resilience is because there's a very strong correlation with people being pushed into poverty due to out-of-pocket expenses. For example, 800 million, they spend more than 10% of household income on healthcare, and 100 million people get pushed into poverty annually due to healthcare costs. So to run through who we are, I'll take you step by step. So what we've done is to build a suite of innovative digital tools, and they help us with the following. We gather insights in the community. We equip community members' local health resources with our app. They go door to door to collect health data, income levels, and we can understand where the needs are. After that, when we understand the needs based on the insights, we work with partners, both in the private sector, like pharmaceuticals, like Johnson & Johnson and Pfizer. We also work with the government to run services, like run rural health clinics in these communities. We run screening events like hepatitis B screening with Gilead, and we make these healthcare services accessible in these communities. After that, once we found the patients, we manage them on an ongoing basis. So this could be to make medication available to them, to remind them to take their medication, or to do screening on an ongoing basis. And lastly, we deliver the products that were typically available in a hospital 1 to 5 hours away from these communities. We manage the last mile delivery into these villages, all through using our offline capable platforms. Basically, what we're trying to do is to drive access in remote communities through 3 A's: awareness, availability, and making it affordable. Sorry, I'm just going to minimize my screen. Not too sure if you can see it. Okay, perfect. Yeah, so in terms of our business model, there are 4 main ways that we make revenue. The first one, tying back to what we do, is the insights. So we work with private sector and government. We churn out these data that typically they don't have, because these are underserved remote communities, and we provide some form of consultancy and model the projects for them. After that, we also work as their implementation partners. We run these services on the ground. We do have our own field force that can run these diagnosis, screening events. We do health worker trainings for these partners. Thirdly, we also, oops, not clicking. Thirdly, we do the patient management on an ongoing basis, or we train health workers. For example, with Johnson & Johnson, we have a very strong partnership where we are strengthening the local health resources and training health workers on a monthly basis. Lastly, with the logistics, when we bring in the medication or insurance plans to the communities, we earn a small delivery fee or commissions based on what we sell on our online marketplace. So just to take you through our financials, we have steadily doubled our growth in terms of revenue from B2B projects and services and subscriptions. Despite COVID, we have managed to secure quite a number of projects this year. For example, diabetes screening with Biocon, health worker training with Johnson & Johnson, and dengue awareness with Pfizer. The reason why we have 2021 confirmed revenue is because we also do it on a milestone basis. So we already have secured that project. We have launched our e-commerce marketplace this year, and despite there being a slight dip due to COVID in March and April, the moment that our field force were allowed to go out and sell these products, and when we launched in India in September, we really saw a spike, especially when it came to insurance sales in India. So I guess for our vision and growth, what we actually really want to do is by 2030, we will connect 250 million people to primary healthcare services. How do we do this? We'll continue working with private partners. What we see is that CSR is becoming a key focus, social impact, and things like that are getting more budget. So we'll work with them to open their business lines and collaborate with them to reach more. On our tech side, we will continue building and reaching more residents and making them aware of these health and financial services. We're currently in Philippines, Cambodia, and India, and we're looking to launch in Indonesia, Myanmar, Vietnam, and Bangladesh next year. So very quickly, I'll take you through our tech roadmap. With a couple of partners like UNICEF, we are going to roll out a health wallet and point system so that people can have more autonomy over their financial health. And we're also going to do an income-based assessment so that we can roll out some form of tiered pricing. Right now, we are offering over 1,200 products on our e-commerce platform. We're working with people like Philips, Zulik Pharma, and Novartis, and we've gotten externally assessed, and it showed that for every dollar invested in REIT52, we save these residents $2.10 on their healthcare costs. So just very quickly, our last slide right now, we are raising our Series A, that's around $3 million, and we're looking to expand our core team, build more partnerships, and grow into new countries and develop our app further. Thank you so much for taking the time to listen to me, and I'm looking forward to connecting with all of you.
Great, thank you. Thank you, Edwin.
Sorry, a little bit over time.
No worries. No, not at all. We do have some time. Great, thank you. Great. Next up, I see Sharon, you're ready already. Great. So we have Sundang Insurance from Malaysia. Please join me to welcome Mr. Sharon Raj.
Can you see my slides?
I can see you and your slides.
Oh, okay. All right. Good afternoon, good morning, and good evening, everyone. I'm from Malaysia, the land of great food. I'm from Sundang. We are an insurtech platform. We enable alternative distribution channels to upsell insurance with a click. The likes of MyCash, MyReach, Reach52 can now upsell insurance through our system technologies. The problems with the insurance industry is quite common in people who works in the insurance industry in Southeast Asia. But to recap, only 10% of the sea population is insured. And the reason is because the insurance companies, majority of the insurance companies are lacking in technologies, and they don't have great API technological system, which then leads them to a lack of availability for creating bite-sized micro insurance, which I'll show you in a short while. We are currently in Malaysia, where we've been in the market for close to 2 years. We are about to start our business in Bangladesh by the year end, where there is a huge potential of over 161 million with a market insurance penetration of 1%, and in Philippines by April next year. In terms of the how the business work and how our APIs and our system works, this is an example. This is a delivery platform similar to your Grabs, your Gojeks of Southeast Asia. When an SME makes a sale, they will go to the delivery platform. They will key in the items they want to deliver, the type of item that they're selling, and where they want to deliver to. With just a click of a button, as you can see here, with just a click, with no questions asked, extremely frictionless, they can now buy insurance to cover for their deliveries. And at that point of time, policies will be issued in 1.26 seconds. So there'll be there's no underwriting, there's no delays. Everything is done simultaneously through the system, through Sundang's API solution. So the partners for the past 2 years, we have got from the likes of startups, which is one of the leading startups such as GoGet, Service Hero, Udo, to e-wallets such as MyCash and BigPay, microfinance institutions such as Udo, and a local microfinance, Co-Hijrah, which is the largest microfinance institution in Malaysia, and corporates as well. GHL, the leading payment gateway, Thundermatch, the leading IT retailer, DG, one of the leading telcos, and Udo, and also one of the leading telcos in just in the space of 2 years. In terms of attraction, last year, September, we were doing an average of 10 partners only. Right now, we have got over 45 partners. As you can see, a 4x growth in just a year with the assistance of the UNCDF program. In terms of monthly transactions, last year, September, we were doing 450 transactions monthly. Now, we're doing 3,500 transactions monthly. Cumulatively, we have sold over 40,000 policies, have an access over 30,000 touch points through our partners in Malaysia, and over 1.5 million partner database cumulatively that we can access to right now with the right insurance product through our partners. Sorry. In terms of how we make money, it's quite straightforward. We make money from the insurance sales. We take a commission of up to 25%. The higher or the more bigger the partner database, the higher is the attachment rate, and the higher will be our commissions in terms of the margins we make too. In terms of our asks, we are looking to raise a pre-series A at 750k USD, and this is the breakdown of it. Majority will go towards technology development in our Bangladesh and Philippines market, and also for marketing and partnerships and to do what we do best, which is to get more partners and to serve the underserved. And this is my details, and I look forward to see you in the breakout room. Thank you.
Great. Thank you, Sharian. Perfect. We have only two companies left. And the next one is, I would like to invite Zamtel from Zambia. So please welcome Mr. Samson Mwanza.
Good afternoon. I hope you're able to see my screen.
Yes, I'm able to see.
Okay. My name is Samson Mwanza. I'm the country operations manager for Zamtel. Zamtel is one of the MNOs in Zambia. It's the oldest telecommunication company with the largest network coverage. We have 60%, over 17.9 million is the population of Zambia in Southern Africa, and 60% of the population is in rural areas. Transporting cash to the last mile is expensive. We've got limited access to financial services. In fact, the vast majority of the rural area doesn't even have the banking service. We have a solution to have a last mile access to cash through an agent distribution network backed by our nationwide network infrastructure. We have bulk payment solution enabled by the integration with the government of the Republic of Zambia with the Ministry of Finance Payment Systems, which is able to dispense welfare benefits to almost 1 million earmarked beneficiaries in Zambia alone. There's bulk payment solution integration can also work with multinational companies who've already integrated with the World Bank and the United Nations. World Bank with supporting women's lives. The United Nations has got a lot of need to distribute, for instance, food to the refugees. We've got a lot of refugee camps in Zambia in the rural area. They no longer distribute food, but they distribute money. And this is how it works. An institution like the World Bank will come to Zamtel. The one like Zamtel, a laptop, and Zamtel processes the money and sends an SMS at a click of a button to these 50,000 beneficiaries. They'll receive the payment, and then they'll go to our agent who will be able to give them cash. And this is not only the institutions like the World Bank, the government, but the solution is also able to pay salaries of quite a lot of MSMEs, especially Zambia being second largest producer of copper in the world, and cobalt, which is one of the biggest input to the electric cars. We've got a lot of contractors mining, but they are paying salaries over the counter. So the payment solution enables payments to these contract workers with a click of a button to their mobile wallets. These are the kind of beneficiaries that we are, or customers that we are servicing. The social cash transfer beneficiaries, over 1 million. Pensioners to get their pension, farmers in outgrower schemes, women, youths, and MSMEs. Usually they'll sell their products, but they have nowhere to bank their money. Our revenue model is purely on transaction fees, which is tiered in bands based on the amount paid. We share the agent receive the 60% of the transaction fee, and Zamtel will receive the 40%. We currently have over 674,000 active accounts with 59,534 touch points across the country. On the platform, we've got around 6 products, and year to date, this year alone, we've processed over $2.5 million. We have integrated already with around 14 financial service providers. These are banks and other partners. We've already integrated with 3 big chain stores across the country and 3 developmental partners. Our growth has been very, very significant, notwithstanding the COVID, which was highly impactful in April, but we've seen our growth in volume significantly huge. If we compare year on year, November 2019 with November 2020, we've grown about 300% in volume. So we're looking for investment worth $3.5 million, majority of it to expand the operations predominantly in rural areas. We're also looking for partners, especially those who have got a cause for financial inclusion and financial literacy, who can partner with us to conduct these financial literacy trainings and financial inclusion for our rural sector, our rural area of Zambia. And that's my details. I'm very much grateful and thank you for following me. Thank you for listening to me, and those are my contact details. Thank you very much.
Thank you. Thank you, Samson. Great. Now we have the last session, the last company to present. And I would like to invite the last company, Zpay from Ghana. Please welcome Mr. Andrew Techiapia for his presentation. The floor is yours, Mr. Andrew.
That was good. That was good.
Good afternoon, everybody. Good afternoon, everybody. I don't know if you can hear me, but good afternoon, everybody.
Yes, I can hear you. We can hear you.
Great. So my name is Andrew Techiapia, and I'm the Managing Director and Founder of Zpay Ghana. Zpay is actually a challenger fintech with an Africa focus based on the African continent. This morning, I'm going to talk you through the problems we encounter in Africa around remittance and how we're resolving them. As I earlier said, we're a remittance to wallet focused company. So the 3 major challenges we have in our part of the world is having last mile access. Your average remittance receiver will travel 1.9 miles on average to pick up their cash. About 400 million transactions come into Africa, valued at 60 billion. And these people have to travel such long distances to the banks and have to wait, sometimes have to come back the next day to pick up their cash. What we do is trying to resolve this problem. The next problem we're trying to resolve is a high cost of remittance. On average, Africa receives about 7.8 to 8.9% of the principal amount that is sent, which is quite high compared to other parts of the world. The next problem we're trying to solve, and we solve every day, it's also the lack of insurance. So the bottom of base do not have insurance. Africa's insurance penetration is 3%. So again, it's a big problem. And in the period of COVID-19, it appears that only the wealthy can actually buy insurance. How are we solving this problem? We solve the remittance problem by using digital assets. So we help by paying remittance into mobile money wallets, remittance onto Visa cards, and remittance into bank accounts. Now we leverage digital to be able to reduce the high cost of remittance by 3%. If you know MoneyGram, for example, as a partner, currently we have a promotion running in Europe, in the UK, it's free to send money home. That is all part of the efforts we do to reduce the cost of remittance. On the insurance side, the trick we discovered is a lot of immigrants and diasporans abroad want to buy these services for their loved ones in Africa because it's cheaper. So for as low as £2.50, they're able to buy beneficiary insurance on a monthly basis for their loved ones, which take care of things like dread disease, sicknesses, and all other major issues. Now, in terms of our spread, we have our presence across 9 active markets and 23 markets. 9 active markets means that we have business every month in these markets. Our biggest corridor, obviously, being Ghana. We have 22 million customers, and the demographics are 60% women, 37% men, and about 3% 18 and above, 18 and below. In terms of our licensed markets, we're licensed across Europe and Ghana, which gives us the strength to be able to do what we do. How do we monetize our transactions? We monetize, first of all, by remittance payments to wallet, which we charge 60 cents on every transaction. We also monetize when they do the cash out of the mobile money. So my previous presenter who's from Zamtel talked about the fact that they have a mobile money solution. When our customers go to Zambia on Zamtel and withdraw their money, we also make a commission of 0.5 per every transaction. Then we also have the peer-to-peer transfers, which basically means that users can transfer money in between themselves. Then the last way we make money is also on the settlement gain. Because we're a wholesaler for Forex, we make gains on the Forex anytime we change them into local currency. Don't forget, we trade in over 6 to 8 currencies across Africa. How we've done, we've grown over the years significantly. We started operations in 2014, and during this period, our revenue has grown steadily. In 2020 year to date, we've done $2 million in revenue. We're projecting to do $8 million. This is obviously as a result of our total process volumes, or what you call turnover. In turnover, we've done $400 million for 2020. And for 2021, we estimate to do $800 million. In terms of user growth, we're looking to jump from 2 million to about 10 million, inclusive of our mobile money assets. Our partner network is huge. We have over 50 partner network spread across money transfer operators, the likes of MoneyGram, Ria, Small World, mobile money operators, payment providers, and insurance. What we are asking for is $5 million and partnership one remittance payment lending. We're looking to spend the money 70% on regulatory capital, 20% on distribution, and 10% on talent development. My name again is Andrew, and you can reach me at this, and we look forward to a partnership, and we look forward to raising Series A money so that we can grow the African network and make remittance seamless and completely digital on the continent. Thank you very much.
Yeah. Thank you, Andrew. Great. Now you have heard all the companies. You will have the chance to connect with them. I know our situation here is really different compared to the normal time when we actually watch companies pitching live, and then after the session, we can easily go up to them and say hello. So I really encourage all of us here just to say hello to each other and click on the link that is being shared on the chat box, which is the breakout rooms, just to say hello and introduce ourselves. And they are grouped according to the companies. Please feel free to reach out to them at their respective breakout room. I suggest you also could use the chat box too in the breakout room. My team and I will be moving around the breakout room in case you would like to connect with us. So thank you again for joining us today, and have a lovely week. Have a lovely day ahead.